When discussing liposuction at SynergyMD plastic surgery, typically patients will hear the word VASER. VASER is a technology that helps me achieve better outcomes for patients when I'm performing liposuction. Classic liposuction involves taking a metal straw that's called a cannula with holes on one end and a vacuum hose connected to the other, and it is literally just shredding fat from the surrounding connective tissue. It is typically pretty painful, and it does create a lot of secondary damage in the area where the fat is removed, if done bluntly and we'll say kind of unsophisticatedly. VASER is a very nice technology where it is a solid metal probe that vibrates at an ultrasonic frequency. And what this does is it helps to loosen the fat from the surrounding connective tissue so that when we take that cannula and suck the fat out, it comes out in a much more passive manner, creating less damage to the surrounding tissue if done appropriately. It is actually something that I do typically in conjunction with fat grafting, where fat that I've removed is then transferred to another part of the body with certain settings that help to preserve the viability of that fat and still leaving behind a nicer contour in the area where liposuction has been performed. A common question I will get is, if you're doing liposuction and you're removing fat, can you take that fat and put it somewhere else on my body so it doesn't go to waste? And the answer to that is yes. Autologous fat transfer, or fat grafting, involves taking fat away from one part of the body and then injecting it into another part of the body. There are a lot of different techniques that are implemented to try to achieve this, and that can actually impact the amount of fat that survives. If you do your own research and you go online, you may find fat survivability to be as low as 30 to 40% or as high as 90%. And appropriately, you may ask, what is up with the discrepancy between these two? The answer is, it depends upon how that fat is treated once it's been removed. When I do fat transfer, I use a device that helps to wash all of the bad, damaged fatty tissue away. We also wash away the connective tissue and any of the blood, anything that we don't want to re-inject, because the predictability of that tissue is less. We only want to inject nice, healthy tissue that has been processed appropriately. And in doing so, we have less fat to transfer, but that fat that we do transfer ought to have north of 90% viability, which leads to more predictable end results.